Okay, it's loading up. Hold on, baby. I'll get you some in a second. Hold on. All right. Today is Medicare Minute. It's another Wednesday. My name is Nicole Bashiri. I'm the Family Consumer Sciences Extension Agent here in Bath County. And we are talking with Saskia Hollenberg. I'll let her introduce herself and go ahead and get started.
Hi guys, I appreciate it, Nicole, and hi Shauna. I just wanted to thank you guys for having me again. I will share my screen now. We will have a short session today. I want to address a few things which a lot of people are concerned about is, and that would be dental and vision. Quick note to myself about myself. It's my name is Saskia Hollenberg. I'm licensed agent, independent broker, actually. Oops, a little too fast. Independent broker, and I have active insurance licenses in Ohio, Tennessee, North Carolina, Idaho, Virginia, Michigan, Florida, and our beautiful Kentucky. I love to help people with their Medicare needs, and I love to help share information about Medicare and all the surrounding difficulties to help to solve it. My background in general is management. I have managed several companies, and I am from, most of you guys know that, from Germany, in Bavaria. This is southern Germany, from the mountains. And now I found my home here in P-Sticks, Owingsville, Kentucky. We have 2 horses, 2 rescue dogs, and a ton of chicken. And if I don't work, I love to garden, to can, and horseback ride. Little pictures here for you guys. This is here my brother, for example, in Germany. Here are horses, a little bit the view, and then our puppies. Here's a couple testimonials from clients I helped out with. And today's subject is Medicare, dental and vision services. Can you see my screen? Nicole, could you just check that real quick if you can see my screen?
Yes, we can.
Perfect. Thank you so much. The presentation is being presented from Medicare Scholars. And here we go. Today's agenda is dental vision and the alternative coverage for dental and vision. So everybody should have the Medicare and You handbook. And this is normally something what I always recommend my clients to keep that. It's a book, it's about this size, and there's all the important information about Medicare in there. So what is not covered by Medicare Part A and B? Everybody thinks Medicare covers everything, and that is not quite true. And you will have some costs out of pocket from Medicare Part A and Part B. So here are things that are not covered. If you do not have other coverage like Medicaid or Medicare Advantage plans. So some of these services, they are not covered by original Medicare is most of the dental care. Exams related to eyeglasses or contact lenses, dentures, cosmetic surgery, massage therapy, routine physical exams, acupuncture, hearing aids, or exams to fit hearing aids. Long-term care is not covered, and concierge care is not covered. Today, we're going to focus on Medicare and dental benefits first. And I apologize, I already talked too much this morning. Common dental procedures are what we all know as oral exams, x-rays, cleanings, fillings, crowns, root canal, treatment for gum diseases, extractions, also implants. This is something what I see more and more, that there's a request for implants. And my dad is 89 years old. He's getting right now 2 more implants. But he's in Germany, so the situation is a little different. Now, Medicare Part A, this is the hospital part for Medicare, that will pay for certain dental services that you get when you're in the hospital. That means you have to be admitted. It cannot be outpatient. It cannot be under observation. You have to be admitted. Please make sure when you are in the hospital, ask the nurses, ask the doctors, am I admitted or is it under observation? Is it going under outpatient? Even when you are sleeping a night in the hospital, it could be under outpatient. So make sure this is clarified. So Medicare Part A can pay for inpatient hospital care if you need to have an emergency or very complicated dental procedure. Now, be careful because doctor services might not be covered. Medicare Part B, that is the outpatient part of Medicare, that will possibly pay for medical reconstructions of the jaw due to a disease or an accident. I can give you an example just in case, for example, you have cancer in the sinus cavities and, certain parts of the bone would have to be removed. That will fall under a medical reconstruction. Diagnostic testings and images of the jaw to diagnose a condition, and tooth extractions caused by an underlying health condition or a disease. The other things that are covered under Medicare Part B are preliminary dental exams. If you're having an organ transplant or another complicated procedure that requires, a total checkup of your mouth, and it's done during an office visit. These things normally are needed to eliminate the problem that you might have an infection, underlying infection going on in your teeth, and that would be a problem with the organ transplant. So this is why these exams are being recommended. Dental appliances that can help reduce the symptoms of sleep apnea, they also could fall under Part B, the outpatient part for Medicare. But then the diagnosis would be more in direction of the sleep apnea. Let's look at Medicare and vision coverage. By the way, the main things when I see clients are, what about dental and vision? We have talked about all the other things. I thought they're important, but I see more and more from my clients, there is an importance in the vision and dental coverage. And this is almost every single person I see. So this is why I decided to do the presentation today. So vision coverage, that is also something I see quite often is cataracts. Here the surgery costs are covered, but please be mindful, you will have copays on original Medicare as well as if you have a Medicare Advantage plan. And these things you need to keep in mind. So it's not like, oh, it is covered by Medicare and I don't have any copays. This is not quite how it goes. So cataract surgery also includes post-surgery care, which means one pair of eyeglasses with a standard frame or one set of contact lenses. Now, whoever supplies you with the eyeglasses or frames, they have to be able to be enrolled in Medicare. So glaucoma screening is another question I hear quite often, and that is only included for individual with high risks. And here are a few examples. One is a family history of glaucoma, then African Americans age 50 and older, or Hispanic Americans age 65 and older, as well as folks with diabetes. Macular degeneration, here the screenings are included and covered by Medicare, again with copays, keep that in mind. Also the ocular photodynamic therapy is included, as well as some of the outpatient drugs. This is not something I see too often, but I wanted to address it. eye prosthesis, they are included if that is needed due to a birth defect, trauma, or a surgical removal. That would also include polishing and resurfacing of the prosthesis twice per year, one enlargement or reduction in size without any documentation, and the replacement of prostheses if they are stolen, lost, or if they have been damaged beyond repair within the first 5 years. Now look at alternative coverages. We heard a lot what is not covered by Medicare, co-pays, etc. So let's look what we can do to maybe help cover these things. The first thing is definitely a Medicare Advantage plan. These can, Medicare Advantage plans, they can have all kind of additional benefits included. And you're more than welcome to give me a call and say, hey, what is included? Is there something out there? Is there a plan out there which might help me with my needs for dental and vision benefits? So typically we see in the Medicare Advantage plans some routine dental, preventative care, but also some comprehensive dental care and routine vision, as well as an eyewear allowance. Now, these benefits will vary. This really depends on the plan, depends on which area you're in, which plans are available in your area. Again, I'm more than glad to help you with these things. Keep in mind, we're going to have annual enrollment coming up October 15th to December 7th. That is when you can change your plans if you don't have on other special enrollment periods. To give you a little bit of an overview, what the share is of Medicare Advantage enrollees in plans with extra benefits. And these numbers are from 2020. So we have about 79% with vision benefit and 74% with dental benefit enrollees. So this is quite a lot of folks with plans where there are some additional benefits available. Now, health savings accounts. Don't see them too much, but I do run into them. What happens is while you're working, you might be able to put money into health savings accounts. Now, when you're turning 65 and you're on Medicare, you cannot fund those anymore. But you still have money in there. So what are you doing with this? You can use, accordingly to the IRS publication 502, medical and dental expenses can be funded through a health savings account. And that would be including cleaning, x-rays, fillings, extractions, dentures, and other dental ailments. So you could use your money, what you have accumulated in your health savings account, for these dental benefits. Another alternative coverage, now that one here depends on your income, and we addressed that a few months back, and I'm more than glad to go through that again in the future if there is a need for it. Medicare Medical Savings Account, or MSAs. These plans may cover extra benefits like dental, vision, and long-term care, which is not covered by Medicare. Please keep in mind all our Medicare minutes are being recorded, and you can go back to the Bath County Extension site and go and look at them. So you can go back and look what we did the month before. Now, another option is there are individual dental and vision plans. And they're standalone. You can sign up anytime during the year. You do not have to wait till annual enrollment. You can sign up today with effective date September 1st. And there is a ton of different plans out there. So what I normally recommend there is they're all private insurance companies. You need to look if you want to plan with a network or if you want to plan without a network, so you're freer to go wherever you want to. Make sure your dentist is accepting the plan. There are plans out there with smaller amounts per year as a total benefit, larger amounts, or even growing. So if you're staying longer on the plan, you get more benefits. There are some without, where you don't have any pre-existing occlusions. Some do have pre-existing occlusions for 12 months, depending really on the plan and your needs. Most of these plans are covering regular checkups on a basis from day one, maybe with a percentage. So again, this is something, I'm more than glad to address for you. I appreciate it. Today was a short one, I know that, but we're going to have next week a longer one, a longer session. And next week, we're actually going to have a subject which is very, very dear to my heart, and that is veterans coverage. So if you have anybody in the family, or if you yourself are a veteran, first of all, thank you so much for the service, deep from my heart, because I lived in Germany. I lived in Germany under American occupation. The American forces kept us safe there. So that is why I decided I'm going to do next month veterans coverage. If you have questions, feel free to call me. My number is 859-294-7490. You can email me. You can also text me on Facebook. And I appreciate it. Thank you again. And I give it back to Nicole.
Thanks, Sasia. We always enjoy these monthly educational lessons, especially I do, because I didn't know very much or anything really about Medicare. So I'm learning so much from you. So if you have any questions about anything that Sasia has referenced, you can always contact her directly, or you can contact the Bath County Extension Office if you want any other information, or you have any ideas for future virtual programmings as of now. So like Sasia said, we'll be back next month and can't wait to talk to you. Bye.
Thank you, guys.